Riley had always been the type of person who preferred staying in the background. At 24, she worked at the local library in her small hometown, spending her days surrounded by books and helping the occasional visitor find what they needed. She liked the quiet atmosphere and the predictable routine. Most people in town knew her as the girl who barely spoke above a whisper and would blush if anyone paid her too much attention. That Tuesday morning started like any other. Riley woke up, made her usual cup of tea, and got ready for work. But as she was getting dressed, a sharp pain shot through her stomach. She doubled over, gripping the edge of her dresser until the pain passed. She told herself it was probably something she ate the night before. Maybe the leftover pizza had gone bad. The pain came back during her lunch break, stronger this time. Riley was organizing returned books when it hit her like a punch to the gut. She had to sit down and breathe slowly until it went away. Her coworker, Mrs. Peterson, noticed her pale face and asked if she was feeling all right. Riley just nodded and said she was fine, even though she definitely wasn't. By the end of the week, the pain had become Riley's unwelcome companion. It would strike without warning, sometimes mild, sometimes so intense that she would have to excuse herself to the bathroom and wait for it to pass. She tried over-the-counter pain medicine, but it barely helped. Sleep became difficult because the pain would wake her up in the middle of the night. Riley's mother called her that Friday evening, as she did every week. During their conversation, Riley mentioned that she hadn't been feeling well. Her mother immediately went into worry mode, asking a dozen questions about symptoms and demanding that Riley see a doctor. Riley tried to brush it off, saying it would probably go away on its own, but her mother wasn't having any of it. "You can't just ignore pain like that, honey," her mother said firmly. "What if it's something serious? You need to get checked out." The thought of going to a doctor made Riley's anxiety spike. She had always hated medical appointments. The idea of explaining her symptoms to a stranger, having them examine her, and potentially facing bad news was terrifying. But the pain was getting worse, and deep down she knew her mother was right. That weekend, the pain became unbearable. Riley was at home, trying to read a book to distract herself, when a wave of agony hit her so hard that she actually cried out. She curled up on her couch, hugging a pillow to her stomach, tears streaming down her face. This wasn't normal stomach pain anymore. Something was definitely wrong. Monday morning found Riley sitting in the waiting room of her local clinic, nervously fidgeting with the forms she had to fill out. The fluorescent lights were too bright, and the smell of disinfectant made her stomach churn even more. She kept looking at the clock, part of her hoping they would be too busy to see her so she could leave and pretend everything was fine. When they finally called her name, Riley's heart started racing. Dr. Williams, her family doctor since childhood, was kind and gentle as always. He listened carefully as Riley described her symptoms, asked several questions, and then performed an examination. His expression grew more serious as he pressed on different areas of her abdomen. "Riley, I'm concerned about what you're describing," Dr. Williams said, washing his hands at the small sink. "The location and type of pain you're experiencing, along with some tenderness I'm feeling during the exam, suggests this could be your gallbladder." The word gallbladder sounded scary to Riley. She wasn't even sure exactly what it was or what it did. Dr. Williams explained that it was a small organ that helped with digestion, and sometimes it could develop problems that required medical intervention. "I want to send you for some tests," he continued, "an ultrasound and some blood work to get a better picture of what's going on. But I have to be honest with you, Riley. If this is what I think it is, you might need surgery." The word surgery hit Riley like a truck. She had never had any kind of medical procedure beyond routine checkups. The thought of being cut open was absolutely terrifying. She sat there in stunned silence, trying to process what the doctor was telling her. The tests confirmed Dr. Williams' suspicions. Riley's gallbladder was inflamed and full of stones. The ultrasound technician, trying to be reassuring, mentioned that gallbladder surgery was very common and usually went smoothly. But to Riley, it felt like her world was falling apart. "The good news is that we caught this before it became a real emergency," Dr. Williams explained during their follow-up appointment. "But we do need to address this soon. I'm going to refer you to a surgeon who can discuss your options." Then came another blow. Riley's basic health insurance, which was all she could afford on her library salary, had limited coverage for surgical procedures. The local hospital where Dr. Williams usually sent patients was considered out of network. Her only option for affordable care was a public hospital about 2 hours away in the city. Riley had rarely left her small town, and the idea of traveling to a big city hospital by herself was almost as frightening as the surgery itself. She called her mother, barely able to speak through her tears as she explained the situation. "Don't worry, sweetheart," her mother said, trying to sound calm despite her own obvious concern. "We'll figure this out. Your father and I will drive you there, and we'll make sure you get the best care possible." The next few days were a blur of phone calls, insurance paperwork, and preparation. Riley had to take time off work, something that made her feel guilty even though everyone at the library was understanding and supportive. Mrs. Peterson even offered to bring her meals after the surgery. As the date approached, Riley found herself unable to eat or sleep properly. She spent hours reading about gallbladder surgery online, which only made her more anxious. Every article mentioned possible complications, recovery times, and scary-sounding medical terms that she didn't understand. The night before her trip to the city, Riley packed a small bag with shaky hands. She included comfortable clothes, toiletries, and a book to read during the waiting periods. Her mother had made a list of questions to ask the surgeon, knowing that Riley would probably be too nervous to think of them herself. Lying in bed that night, staring at the ceiling, Riley couldn't help but think about how much her life was about to change. She had always been cautious, always played it safe, always stayed in her comfortable bubble. Now she was being forced into a situation that was completely out of her control. Little did she know that this medical crisis would lead to an encounter that would change her perspective on life in ways she never could have imagined. The city hospital was nothing like Riley had imagined. As her parents drove through the busy streets that morning, she pressed her face to the window, watching the tall buildings and endless streams of people. Everything moved so fast here, so different from her quiet hometown where she knew every street corner. When they finally arrived at St. Mary's Medical Center, Riley felt completely overwhelmed. The building stretched up into the sky with glass windows reflecting the morning sun. Cars and ambulances moved in and out of the circular driveway constantly. People in scrubs, business suits, and regular clothes hurried past them in all directions. "This place is huge," her father muttered, looking around for a parking spot. "How do people find their way around here?" Riley's stomach was churning, and not just from the gallbladder pain. She had barely slept the night before, and now seeing this massive medical complex made everything feel more real and more scary. Her mother reached back and squeezed her hand. "It's going to be fine, honey," she said, though Riley could hear the nervousness in her voice too. "These city hospitals have the best doctors and equipment. You're in good hands." After finding parking and navigating through what felt like miles of hallways, they finally reached the surgical consultation office. The waiting room was crowded with patients and family members, all looking just as anxious as Riley felt. She checked in at the reception desk, her voice barely audible as she gave her name and appointment details. "Dr. Hayes will see you shortly," the receptionist said with a professional smile. "Please have a seat and someone will call you back." Riley sat between her parents, fidgeting with the strap of her purse and watching the clock on the wall. Every few minutes, a nurse would come out and call someone's name, and that person would disappear through the heavy doors leading to the consultation rooms. Riley wondered what kind of doctor this Dr. Hayes would be. She pictured an older man with gray hair and a serious expression, someone who would talk quickly and use words she didn't understand. "Riley Thompson?" a friendly voice called out. Riley looked up to see a young nurse with a warm smile gesturing toward the doors. Her parents started to get up with her, but the nurse gently explained that the initial consultation would be just with Riley, and they could join them afterward if needed. Walking down the hallway, Riley felt like her legs might give out. The nurse, whose name tag read Janet, seemed to notice her nervousness. "First time meeting Dr. Hayes?" Janet asked as they walked. "You're going to love him. He's one of the best surgeons we have here, and he's got this way of making everyone feel comfortable. I've seen him calm down patients who were absolutely terrified." They stopped at a door marked Consultation Room 3. Janet knocked and opened the door, announcing Riley's arrival. As Riley stepped inside, she was surprised by what she saw. Dr. Hayes looked nothing like what she had expected. He appeared to be in his early 30s with dark hair and kind eyes behind stylish glasses. He was wearing the typical white coat, but somehow he seemed more approachable than intimidating. When he smiled and stood up to greet her, Riley noticed that he wasn't much taller than she was. "Hi, Riley, I'm Dr. Hayes," he said, extending his hand for a handshake. His grip was firm but gentle. "Please have a seat. I know this whole situation must be pretty overwhelming for you." Riley sat down in the chair across from his desk, surprised by how normal his voice sounded. She had expected someone more formal, more distant. Instead, Dr. Hayes seemed genuinely interested in making her feel at ease. "So, you've been dealing with some gallbladder issues," he said, looking at the file on his desk. "Dr. Williams sent over your test results and I've had a chance to review everything. But I'd like to hear from you about what you've been experiencing." Usually, Riley would have given short, quiet answers and tried to get through the conversation as quickly as possible. But something about Dr. Hayes made her feel like she could actually talk to him. Maybe it was the way he leaned forward slightly when she spoke, or how he nodded encouragingly, or the fact that he didn't seem to be in a rush. She found herself explaining not just her symptoms, but how scared she was about the whole situation. She told him about never having surgery before, about being nervous in hospitals, and about having to travel so far from home for treatment. "That's completely understandable," Dr. Hayes said when she finished. "Surgery is a big deal, especially when it's your first time. And being away from your support system makes it even more challenging." He pulled out a tablet and showed her a simple diagram of the gallbladder and surrounding organs. Unlike other doctors who had rattled off medical terms, Dr. Hayes explained everything in words Riley could understand. He showed her exactly what was wrong, what the surgery would involve, and what she could expect during recovery. "The good news is that this is a procedure I've done hundreds of times," he said. "We use a minimally invasive technique, which means smaller incisions, less pain, and faster recovery. Most patients go home the same day or after just one night in the hospital." Riley felt some of her anxiety melting away as he spoke. For the first time since this whole ordeal began, someone was explaining things in a way that didn't make her feel stupid or more scared. "Now, I know you're nervous," Dr. Hayes continued, "and that's perfectly normal. But I want you to know that my team and I are going to take excellent care of you. Is there anything specific you're worried about that we haven't talked about?" Riley hesitated for a moment, then asked the question that had been bothering her the most. "What if something goes wrong? What if there are complications?" Dr. Hayes didn't brush off her concern or give her false reassurances. Instead, he acknowledged that while complications were rare, it was smart of her to ask about them. He explained the safety measures they took and the monitoring equipment they used during surgery. "I'll be honest with you, Riley. I became a surgeon because I wanted to help people who were facing scary situations just like this. Every patient matters to me, and I don't take that responsibility lightly." There was something in his voice that made Riley believe him completely. She had expected to feel like just another case, another name on a schedule, but Dr. Hayes made her feel like her concerns were valid and important. As the consultation wrapped up, Dr. Hayes walked her back to the waiting room where her parents were anxiously waiting. He took time to explain everything to them as well, answering their questions with the same patience he had shown Riley. "Your daughter's going to do great," he told them. "We'll take good care of her." On the drive back to their hotel, Riley was quiet, processing everything that had happened. Her parents were clearly relieved by the doctor's confidence and expertise. "He seemed really nice," her mother said. "Much younger than I expected, but very professional." Riley nodded, still thinking about the consultation. There had been something different about Dr. Hayes, something that went beyond just being good at his job. She couldn't quite put her finger on it, but she had noticed little things during their meeting that seemed unusual for a hospital setting. Little did she know that her instincts were picking up on clues about Dr. Hayes that would soon reveal a truth more surprising than anything she could have imagined. Surgery day arrived faster than Riley had expected. She had spent the previous evening at the hotel with her parents, trying to eat a light dinner and failing miserably. Her stomach was too twisted with nerves to handle much food. Her mother had packed and repacked her small overnight bag 3 times, while her father paced around the room checking and rechecking the alarm clock. "We need to be at the hospital by 6 in the morning, her mother said for the 10th time. "That means leaving here by 5:30 to account for traffic." Riley barely slept that night. Every time she started to drift off, her mind would race with thoughts about what was going to happen. She had watched some videos online about laparoscopic surgery, which helped her understand the process but also made her more aware of everything that would be happening to her body. The hospital at dawn was a completely different place than it had been during her consultation. The hallways were quieter, with only essential staff moving around. The pre-surgery area felt clinical and serious, with bright lights and the constant beeping of monitors from other patients getting ready for their procedures. Riley changed into the hospital gown and surgical socks, feeling vulnerable and exposed. The pre-surgery nurse, a kind woman named Beth, helped her get settled on the gurney and started the IV line. Riley's parents were allowed to stay with her until it was time to go to the operating room. "The anesthesiologist will be here in a few minutes to talk with you," Beth explained, checking Riley's blood pressure and pulse. "And Dr. Hayes usually stops by to see his patients before surgery too." Sure enough, about 20 minutes later, Dr. Hayes appeared at her bedside. He was already dressed in surgical scrubs, but he still had that same calm, reassuring presence that had impressed Riley during their consultation. "How are you feeling this morning?" he asked, pulling up a chair next to her gurney. "Any questions or concerns before we get started?" Riley's parents immediately started asking about the procedure timeline and what they should expect. Dr. Hayes answered each question thoroughly, but Riley noticed that he kept his attention focused mainly on her, making sure she felt included and informed. "The whole procedure should take about an hour," he told them. "It's a very routine surgery, and I expect everything to go smoothly. Riley will be in recovery for a couple of hours after that, and then we'll see how she's feeling." When it was time to go to the operating room, Riley felt her heart start racing. Her parents kissed her goodbye, and she could see tears in her mother's eyes even though she was trying to stay strong. "I'll see you in a little bit," Dr. Hayes said as they started moving her gurney down the hallway. "My team is excellent, and we're going to take great care of you." The operating room was exactly like what Riley had seen in movies, with bright lights, lots of equipment, and several people in surgical masks and gowns. The anesthesiologist introduced himself and explained what would happen as he administered the medication that would put her to sleep. "Just count backwards from 10 for me," he said gently. "You're going to feel relaxed, and the next thing you know, you'll be waking up in recovery." Riley made it to about 7 before everything went dark. Waking up after surgery felt like swimming up from the bottom of a deep pool. Riley's first sensation was of someone calling her name softly. She opened her eyes to find herself in a different room, with a recovery nurse checking her vital signs. "Welcome back, honey," the nurse said with a smile. "Surgery went perfectly. Dr. Hayes will be by to check on you in a few minutes." Riley felt groggy and sore, but surprisingly not as bad as she had expected. The nurse explained that they had given her pain medication through her IV, and that the minimally invasive technique really did make a difference in recovery. Her parents were allowed to come back about an hour later, and Riley could see the relief on their faces when they saw her awake and alert. Dr. Hayes said everything went exactly as planned, her father said, squeezing her hand. "No complications at all. He said you should be able to go home this afternoon." Over the next few hours, as Riley became more awake and alert, she started noticing things that seemed a bit unusual. When Dr. Hayes came to check on her, she glimpsed him through the window talking to another doctor in the hallway. Even in his surgical scrubs, something about him seemed different from the other medical staff. Later, when he was leaving the hospital, Riley happened to be walking slowly in the hallway with her mother for some post-surgery exercise. Through the window, she saw Dr. Hayes getting into a car in the parking lot. It wasn't just any car. It was a sleek, expensive-looking vehicle that seemed out of place in the hospital employee parking area. "That's a nice car," her mother commented, following Riley's gaze. "Must be doing well for himself." Riley didn't think much of it at the time, but it stuck in her mind as something that seemed different from what she expected. From a hospital doctor. The next morning, Riley was feeling well enough to be discharged. Dr. Hayes came by during his rounds to check her incision sites and give her final instructions for at-home care. "Everything looks perfect," he said, examining the small bandages over her incisions. "You're healing beautifully. Just take it easy for the next week or two and you should be back to normal activities soon." As he was finishing up his examination, Riley noticed his watch. She didn't know much about expensive jewelry, but even she could tell that this wasn't an ordinary timepiece. It caught the light in a way that suggested it was made of precious metal, and the design looked like something that would cost more than she made in several months at the library. But what really caught her attention happened during the discharge process. Riley's parents had been dealing with insurance paperwork since early that morning, and there seemed to be some kind of problem with coverage approval. Her mother was getting increasingly frustrated with the billing department, and Riley could hear heated phone conversations about pre-authorization and out-of-network charges. "I don't understand," her mother was saying to someone on the phone. "We were told this would be covered. Now you're saying we owe thousands of dollars?" Riley felt sick thinking about the financial burden this would put on her family. Her parents had already taken time off work and paid for hotel rooms, and now they were facing a massive medical bill that nobody had anticipated. About an hour later, something strange happened. A woman from the billing department came to Riley's room with a confused but relieved expression. "I'm not sure exactly what happened," she said, "but there's been some kind of adjustment to your account. Your insurance coverage has been sorted out and your remaining balance is much lower than we initially calculated." Riley's parents looked at each other in confusion. "What kind of adjustment?" her father asked. "I honestly don't have all the details," the woman replied, "but someone from administration made some calls and everything has been worked out. You're all set to go home." As they were leaving the hospital, Riley couldn't shake the feeling that something unusual had happened. The billing mix-up had been resolved too quickly and too completely for it to be just a simple mistake. And she kept thinking about Dr. Hayes and the small details she had noticed. The expensive car, the watch, the way other staff seemed to treat him with a level of respect that went beyond normal professional courtesy. On the drive home, Riley dozed in the back seat, but her mind kept returning to these observations. There was something about Dr. Hayes that didn't quite fit the picture of a typical hospital surgeon, though she couldn't put her finger on exactly what it was. 2 weeks after her surgery, Riley was feeling much better. The pain was gone, her incision sites were healing nicely, and she was starting to get back to her normal routine at the library. Her follow-up appointment with Dr. Hayes was scheduled for a Thursday afternoon, and this time she felt confident enough to make the trip to the city by herself. Her parents had wanted to come with her, but Riley insisted she could handle it alone. She was proud of herself for becoming more independent after everything she had been through. The surgery had been a success, and she was ready to put this whole medical chapter behind her. The hospital felt more familiar this time as Riley walked through the main entrance. She knew which elevators to take and where to find the surgical follow-up office. The receptionist recognized her and checked her in with a friendly smile. "Dr. Hayes is running about 15 minutes behind today," she said. "Feel free to have a seat, and we'll call you as soon as he's ready." Riley settled into one of the waiting room chairs with a book she had brought from the library. She was actually looking forward to seeing Dr. Hayes again and showing him how well she was doing. In a strange way, she felt like he had become more than just her surgeon. He was the person who had helped her through one of the most frightening experiences of her life. About 20 minutes later, Riley was still waiting when she overheard a conversation at the reception desk that made her ears perk up. A well-dressed woman was talking to one of the office staff members about scheduling difficulties. "We really need to coordinate this better," the woman was saying. "Dr. Hayes has his hospital schedule, but then there are all these board meetings and foundation events that keep coming up. His assistant called this morning about another conflict next week." Riley tried not to be obvious about listening, but she was curious about what kind of meetings a surgeon would have outside of the hospital. "I know it's complicated," the staff member replied, "but honestly, having someone like Dr. Hayes here is such a blessing for this hospital. Not just because he's an incredible surgeon, but because of everything else he brings to the table." The well-dressed woman nodded. "The administration is very aware of how fortunate we are. It's not every day that someone from the Hayes pharmaceutical family chooses to work in a public hospital instead of opening their own private practice." Riley felt her breath catch in her throat. "Hayes pharmaceutical family?" She tried to process what she had just heard while pretending to read her book. "I still can't believe he insists on keeping such a low profile about it," the woman continued. "Most people in his position would want everyone to know about their background. But he specifically asked us not to publicize any connection to Hayes Medical Industries when he joined the staff." Riley's mind was racing. Hayes Medical Industries was a name she recognized, though she couldn't remember exactly where she had heard it before. It sounded like a big company, definitely bigger than anything connected to their small town. The conversation at the desk continued for a few more minutes, with mentions of charitable donations and research funding, that Dr. Hayes had apparently provided to the hospital. Riley was trying to absorb all of this information when her name was finally called. Walking to the examination room, Riley felt like she was seeing everything with new eyes. The expensive watch, the luxury car, the way her billing problems had mysteriously disappeared. Suddenly it all started to make sense. Dr. Hayes greeted her with the same warm smile as always, and proceeded with a thorough examination of her healing incision sites. Everything looked perfect, and he was pleased with her recovery progress. "You're doing remarkably well," he said, making notes in her chart. "I think we can clear you for normal activities. No more restrictions." Riley was thrilled to hear this news, but she found herself distracted by what she had overheard in the waiting room. She kept studying Dr. Hayes's face, trying to reconcile the kind, down-to-earth doctor she knew with the idea that he might be connected to a major pharmaceutical company. As the appointment was wrapping up, Riley's curiosity finally got the better of her. "Dr. Hayes, can I ask you something?" "Of course," he said, turning to face her fully. "I couldn't help but overhear something in the waiting room about Hayes Medical Industries. Are you related to that company?" For the first time since she had known him, Dr. Hayes looked genuinely surprised. His expression shifted from his usual confident demeanor to something that looked almost vulnerable. He was quiet for a moment, then let out a soft sigh. "I didn't expect anyone to make that connection." "Yes, Hayes Medical Industries was founded by my grandfather. My family has been in the pharmaceutical business for 3 generations. Riley stared at him, trying to process this information. "So you're wealthy?" Dr. Hayes looked uncomfortable with the direct question, but he nodded. "My family has been very successful, yes. The company is worth several $100 million, and I inherited a significant stake when my grandfather passed away a few years ago." Riley felt like the room was spinning. She was sitting across from someone who was worth hundreds of millions of dollars, and he had been treating her like any other patient. More than that, he had somehow helped resolve her insurance problems. "But why are you working here?" she asked, genuinely confused. "I mean, couldn't you open your own practice or work somewhere more prestigious?" Dr. Hayes smiled, and for the first time, Riley could see a hint of sadness in his expression. "That's exactly why I work here. Everyone assumes that because my family has money, I should want the most expensive, exclusive setting possible. But that's not who I am." He leaned back in his chair, looking more relaxed now that the truth was out in the open. "I became a doctor because I wanted to help people who really needed it. People like you, who are dealing with scary medical situations and don't have unlimited resources to handle them." Riley thought about her insurance complications and how quickly they had been resolved. Did you help with my billing situation?" Dr. Hayes looked embarrassed. "I hope you don't mind. I have an arrangement with the hospital administration. When patients face financial hardships that might prevent them from getting proper care, I help cover the costs. But I always insist that it's done anonymously." Riley was speechless. She had never imagined that someone would quietly pay medical expenses for strangers, especially someone who barely knew her. "I've been doing this for about 3 years now," Dr. Hayes continued, "since I started working here. Most patients never find out, and that's how I prefer it. I don't want people to feel obligated or uncomfortable." "But why?" Riley asked. "Why would you do that for people you barely know?" Dr. Hayes was quiet for a moment, looking out the window of the examination room. "Growing up with money, you learn pretty quickly who your real friends are versus who just want something from you. I've had people try to get close to me my entire life because of my family's wealth." He turned back to Riley with a sincere expression. "But when I'm here working as a surgeon, I get to be valued for what I can actually do, not for how much money I have. And I get to help people who judge me based on my skills and my character, not my bank account." Riley sat in stunned silence, trying to process everything she had learned. The kind doctor who had made her feel comfortable and cared for was secretly one of the wealthiest people she had ever met. Yet he had chosen to dedicate his time to helping patients in a public hospital, and he was using his fortune to quietly assist people who couldn't afford their medical bills. "I hope this doesn't change how you think about me," Dr. Hayes said softly. "I really value the honest interaction we've had. It's not something I get to experience very often." Riley sat in her car in the hospital parking lot for nearly 30 minutes after her appointment, trying to process everything that had just happened. Dr. Hayes was worth hundreds of millions of dollars, Yet he had treated her with the same care and respect he would show anyone else. More than that, he had quietly paid for her medical expenses without expecting anything in return or even wanting recognition for it. She thought about their conversation and how uncomfortable he had looked when talking about his wealth. Most people would probably be excited to discover they knew someone so successful and wealthy. But Riley found herself feeling something different. She felt sorry for him. The way he had talked about people trying to get close to him because of his money, and how he valued their honest interaction, made Riley realize that being wealthy might not be as wonderful as everyone imagined. Dr. Hayes seemed genuinely lonely, despite having everything that most people thought would make someone happy. Over the next few days, Riley couldn't stop thinking about their conversation. She found herself wondering what it would be like to never know if people liked you for who you really were, or just for what you could give them. She thought about how Dr. Hayes had chosen to work in a public hospital, helping people who might never even know about his generous spirit. 3 days after her appointment, Riley made a decision that surprised even herself. She drove back to the city not because she had a medical appointment, but because she wanted to talk to Dr. Hayes again. At the hospital, she asked at the reception desk if it would be possible to speak with Dr. Hayes for just a few minutes. The receptionist looked confused. Patients didn't usually come back just to chat with their surgeons. "Is this about a medical concern?" she asked. "We could schedule a follow-up appointment if needed." "No, everything is fine medically," Riley said, feeling her cheeks flush with embarrassment. "I just wanted to thank him properly for everything he did for me." The receptionist made a phone call, and about 15 minutes later, Dr. Hayes appeared in the waiting room. He looked surprised but pleased to see Riley. "Is everything okay?" he asked immediately. "Any problems with your recovery?" "No, nothing like that," Riley said quickly. "I was wondering if maybe we could talk for a few minutes." "I know you're probably busy, but," Dr. Hayes smiled, "I actually have a break between surgeries. Would you like to get some coffee from the cafeteria?" They walked through the hospital corridors together, and Riley noticed that several staff members greeted Dr. Hayes warmly as they passed. It was clear that he was well-liked and respected by his colleagues, not because of his wealth, but because of who he was as a person and a doctor. The hospital cafeteria was busy with doctors, nurses, and visitors grabbing quick meals between appointments. Dr. Hayes led them to a quiet table in the corner where they could talk without being overheard. "I've been thinking about our conversation the other day," Riley began, stirring sugar into her coffee nervously. "And I wanted you to know that learning about your background doesn't change how I see you at all." Dr. Hayes looked relieved. "I have to admit, I was worried about that. Most people treat me differently once they know about the money." "That's actually what I wanted to talk to you about," Riley said. "I keep thinking about how lonely that must be. Never knowing if someone genuinely likes you or if they're just interested in what you can do for them." Dr. Hayes was quiet for a moment, looking down at his coffee cup. "It's been that way for as long as I can remember. Even in medical school, once word got out about my family's company, everything changed. Suddenly everyone wanted to be my study partner or invite me to parties." Riley could hear the sadness in his voice. "That must have been really hard. The worst part is that it makes you suspicious of everyone," Dr. Hayes continued. "Even when someone is being genuinely kind, there's always this voice in the back of your mind wondering what they really want." Riley thought about her own shyness and how it had often prevented her from forming close friendships. "I understand feeling isolated, just for different reasons. I've always been so quiet and nervous around people that I never really learned how to make friends easily." Dr. Hayes looked up at her with interest. "But you're not nervous talking to me now." Riley realized he was right. For some reason, despite learning that he was incredibly wealthy and successful, she felt more comfortable talking to him than she did with most people she had known for years. "I think it's because you've never made me feel like I was bothering you, or like my problems weren't important," she said. "From the very first day we met, you treated me like I mattered." Dr. Hayes smiled. "You do matter. Every patient matters to me, but our conversations have been different, more genuine than most interactions I have." They talked for nearly an hour, sharing stories about their backgrounds and experiences. Dr. Hayes told Riley about growing up in a wealthy family and the pressure he felt to live up to certain expectations. Riley shared her struggles with shyness and how the surgery had actually given her more confidence than she had ever had before. "You know," Dr. Hayes said as their conversation wound down, "I don't really have many friends outside of work. Most of my relationships are either professional or they're complicated by the money situation." Riley felt bold enough to make a suggestion that would have terrified her just a few weeks earlier. "Maybe we could be friends? Real friends, I mean. I promise I'm not interested in your money. Honestly, it kind of intimidates me, but I'd like to stay in touch if you want to." Dr. Hayes's face lit up with genuine happiness. "I would really like that. It's been a long time since someone offered friendship without any ulterior motives." They exchanged phone numbers, and Dr. Hayes promised to call Riley the next week when he had some free time. As they walked back toward the hospital entrance, Riley felt like she was leaving as a completely different person than she had been when she first arrived for surgery, just a few weeks earlier. "Thank you," Dr. Hayes said as they reached the parking area. "Not just for offering your friendship, but for treating me like a normal person." "You have no idea how much that means to me," Riley smiled. "Thank you for saving my life, and for showing me that there are truly good people in the world who help others without expecting anything in return." Over the following months, Riley and Dr. Hayes developed an unlikely but genuine friendship. They would meet for coffee occasionally, and Riley would update him on her life back in her small town while he shared stories about his work at the hospital. Their friendship was built on mutual respect and understanding, with both of them grateful to have found someone who valued them for who they truly were. Riley never returned to being the same shy, quiet person she had been before her surgery. The experience had taught her that she was stronger and braver than she had ever imagined. And Dr. Hayes continued his work at the public hospital, knowing that he had found at least one person who saw him as more than just his bank account. Sometimes the most meaningful connections in life come from the most unexpected circumstances, proving that genuine human kindness and understanding are more valuable than any amount of money.